We would like to continue and also to develop this support for the future. And by doing this, I think we need several areas and issues to look into so that we achieve a more articulated delivery that reaches the people and the communities who need most. We need to improve our communication systems. We have a number of partners here, and sometimes we find very difficult to get communications from some of the partners, particularly the international organizations. So we need to have at least more calculated kind of a communication, either by appointing focal points or by having permanent staff from the organizations that the ministry communicate in case some issues arise during the implementation time. These focal points can be appointed if, when and where necessary. I'm not calling for every organization to appoint focal points, but I think those who do not have regular communication with the ministry, we may need to have focal points, or at least somebody who we can contact if there's a need. We have been, for the first short time I was here, I was seeing the issue of capacity building. I think capacity building is a broad term, and we need to at least find a kind of a goal and strategy that we are looking to achieve in the future, so that we measure, the kind of capacity building we have made, and what will be the end goal of building the capacity of the Ministry of Health. To me, capacity building is that enabling the ministry to achieve, to plan, to implement, to report, to monitor, to supervise the services and the service delivery required from it as mandated. This will include that ministry should be given the capacity to plan, to budget, to discuss with the partners, to implement, to report, and to supervise, and to evaluate also the activities that has been done. The role of the implement of the partners is a more of a backstopping, giving the technical support and training required, and then giving the stake to the ministry so that it has to do the work by itself, rather than partners doing, at least some of the work or all of the work. I think it will be the ministry. If we are looking for the real meaning of the word capacity building. Because at the end, we want to have a goal that at least the ministry can be technically able to deliver the activities that's supposed to happen within that sphere of mandate. I was hearing from UNICEF that some of the activities will go down to the subnational level, going down to the districts. I think that's what the Ministry of Health should do. the role of UNICEF is to help Minister of Health have the capacity also to get things done at the district and at the field level, rather than being the other way around. Yes, I commend this, but how we are doing this is another case. Who is doing this? Getting things done at the district level, decentralizing activities to the district level, including planning also and reporting. So I agree with you, but I think how this should be done can be discussed further and digested. Sustainability should be a goal that we have to achieve. Whatever we are doing should be sustainable. It happens that some of the health centers are supported by either one partner or number of partners in different sections, like health, nutrition, immunization. There are a number of partners who come together within one specific facility. Could there be a way that at least one partner can do whatever is required in this particular health center, so that we track who's doing what where? Because there could be a level of confusion when several partners are coming together in one specific health center. One of the things that I think we can achieve sustainability is to accept that while we have programs at the facilities, we have to allow that cost sharing should be also done parallelly, because we don't have a guarantee that during the lifetime of these facilities, this support is following into it. It's more of a program based in a very limited time. So whenever this external funding dries out, then we have a gap. So completely what we are building for 3 years comes down and shatters within the first week or 2 weeks. We have to look into how we can actually avoid this and make it at least a core activities, core staff that the projects to leave behind when resources end. The argument always is that projects are giving for free. Why people are charging? Yes, but is it good always to give for free? Will that continue until the long-term future? I don't think the answer is no. So we have to look and think what will happen after 3 years when these funds comes to end, what we are doing with this facility. We have to also look into the number of people who are working in a facility funded by a project. Do we need all these people in this very small, facility building? Are we creating more people who can suffer later on when the external funds rise out? Do we need a smaller team who can do, many things in the same facility? So this is something which we have to have more discussions in the future if we are looking to sustainability of the services. Financial support to patients living with HIV/AIDS. I think I was hearing this from UNICEF, and this is one of the things I support very much. when it comes to cash transfer. I oppose cash transfer without, strategy. But I support cash transfer going to people who are living with AIDS, because the situation they are living in is very precarious and very difficult. Even they may not be able to access the employment available in any field. So the kind of living they are facing is very, very, very bad. And it's like they are caught in a very unfortunate situation. I agree with you, because other people, they either come from emergencies, and they can be assisted in a short time, and then they have to get back to their own normal lives. But these people, this group, I think they will be facing a very difficult time for the rest of their life. I think the last thing I would like to share with you is the element of what you call awareness raising. The money we spend on this is very huge. And I think it's time that we have to sit back and look into the effectiveness of the system we are using. In different programs, we have, what was Mustafa, the C4D? We have this in different programs. It's fragmented. It's there by different departments. It flows a more outdated, I think, to my way of looking into it, an outdated kind of a system where you are mounting loudspeakers onto pickups or on Land Cruisers, putting batteries every time to the loudspeakers, and then moving in a very confined area. We need to look into more effective system that can reach, wider coverage, and even with less cost. This is something I think which needs to research and explore an effect if we agree on a different system. Thank you very much. And I hope we will have a very active and discussion today and tomorrow. If I can come tomorrow, we'll come. If not, I think I have delivered my part of the event. Thank you very much.